Hello friends, I hope you are able to listen to me. So let us start discussing about astigmatism. Okay, It- before this lectures, I have already uploaded the lectures on presbyopia, then myopia, hypermetropia. So now we'll discuss the remaining refractive error that is called as astigmatism. So friends, what is astigmatism? Astigmatism is a refractive condition that results when the two principal meridia of eye are having different refractive powers. So the eye is not an exactly a spherical structure, friends. The vertical and horizontal meridia of the eye are having different refractive power. So that's why the parallel rays of light coming from infinity will not be focused at one point. The rays from the rays which are refracted by the vertical meridian will be focused at a different point, and the rays refracted by horizontal meridian will be focused at the different point. So there are two focal points. This is first focal point and this is second focal point, and this is the blurred line. So this is because there is a difference between the two principal meridia. So that is astigmatism basically. So astigmatism can also be defined as a refractive condition in which the parallel rays of light coming from infinity cannot be focused at a point on the retina or at any point. Instead, they will be focused on as a line. So that is astigmatism. So the astigmatism occurs when there is a difference in surface curvature of either lens or cornea. There is a steep meridian and there is a flat meridian. And in case of lens, friends, there may be difference in the refractive index of the lens in different meridia. That also can give rise to astigmatism. That will be lenticular astigmatism. So corneal astigmatism is very easy to understand. The vertical meridia of the cornea may have different curvature than the horizontal meridian. Or in case of lens, this may also happen, or there may be difference in the refractive index in the two meridian. That will lead to astigmatism. So this terms conoid is a concept. It's a very beautiful concept which explains the refraction of rays to the toric surface. So basically, what do you mean by toric surface? Toric surface is a surface in which there is a difference of power in the vertical and horizontal meridian, like the eye. It is not a spherical surface. So the spherical is there is no difference in the refractive power of the vertical and horizontal meridian. So if there is a slight difference like eye, then it becomes a toric surface. So in toric surface, one principal meridian is more curved than the second principal meridian, and the principal meridian with the minimum curvature or with the minimum power is called as base curve of the toric lens. So the configuration of rays refracted through a toric surface is called as terms conoid, and the shape of bundle of light rays at different levels in term conoid is as follows. That is given in the diagram. So at point A, friends, the vertical rays are converging more than the horizontal rays. So the focus will be like an horizontal oval shape. And at point B, that is the first focus, the vertical rays have come to a focus, whereas the horizontal rays are still converging, and so that they form a horizontal line. At point C, the vertical rays are diverging, and their divergence is less than the convergence of horizontal rays, so will form a horizontal oval. At point D, the divergence of vertical rays is exactly equal to the convergence of horizontal rays. So here we form a circle. So this circle is called as circle of least diffusion, which we are interested in. And at point E, the divergence of vertical rays is more than convergence of horizontal rays, so there will be vertical oval. And at point F, friends, the horizontal rays have come to a focus, so they will form a vertical line. That is called as second focus. And beyond F, both horizontal and vertical rays diverge, so they form a vertical oval or ellipse. So the distance between these two focus, friends, this B and F is called as interval of Sturm. So basically what we have understood from this diagram, this Sturm conoid diagram, is that the rays of light are not coming to a point to a point focus anywhere. So at the most, what they are forming a circle of least diffusion in which the divergence of vertical meridian rays is equal to the convergence of horizontal rays. So this circle is called as a circle of least diffusion, and it should fall on the retina so that the person sees clearly. That's the funda behind Sturm's connoid. So asymmetry of cornea or lens or posterior retina, any variation in the refractive index, tilting of the lens, or any eye mass lesion may lead to, or any injury to the cornea or any scar on the cornea may lead to astigmatism. So the astigmatism is of regular and irregular types. So what do we mean by regular astigmatism? Regular astigmatism means what we have described in Sturm's connoid, where the refraction is in orderly manner and the vertical and horizontal meridia are 90 degrees apart. Well, in irregular meridia, the astigmatism varies between various meridia. So the rays of light will not be focused on a line also. So we'll see the diagram of irregular astigmatism later. So what we are interested now is regular astigmatism. So again, it can be corneal, which I already told you. The horizontal, normally the vertical meridian is of cornea is slightly steeper, means convex, than the horizontal meridian. So this is called as with the rule astigmatism. And against the rule astigmatism means the horizontal meridian is more curved than vertical meridian. Then the lenticular astigmatism, that is the astigmatism induced by the lens either because of the change in the curvature of the lens or position of the lens or index of the lens. And there is retinal astigmatism also. So again, the types of regular astigmatism are with the rule astigmatism, against the rule astigmatism, oblique astigmatism, and bioblique astigmatism. So with the real astigmatism, the vertical meridian is more steeper than horizontal meridian. So friends, in this situation, what the patient will require? The patient will require a cylinder at 180 degrees, minus cylinder at 180 degrees. So because the vertical meridian is more myopic than the horizontal meridian. So the axis of negative cylindrical correlation will be between 0 to 20 or 160 to 180. So approximately 180 you can say. Against the rule astigmatism, the horizontal curvature is greater than vertical curvature, and the correction of astigmatism will require a prescription of concave lens at 90 degrees. So that is against the rule astigmatism. So in against the rule astigmatism, the horizontal meridian is more myopic than vertical meridian. तो इसको कैसे याद रखने का है? तो विद द रूल एस्टिग्मेटिज्म में 180 डिग्रीज के आसपास सिलेंडर लगेगा माइनस, और अगेंस्ट द रूल एस्टिग्मेटिज्म में 90 डिग्रीज पे सिलेंडर लगेगा वो माइनस. अगर प्लस सिलेंडर लगा है तो उसका एक्सिस अपोजिट हो जाएगा. So in oblique astigmatism, the power meridian is neither horizontal and vertical. So the patient will require a cylinder between say 130 or 40 degrees or so on. So the principal meridia are more than 30 degrees from vertical and horizontal. So that is oblique astigmatism. And bioblique astigmatism, till now what we have seen that the two principal meridia are at right angle to each other. But in bioblique astigmatism, the two principal meridia are not at right angle to each other. One may be at 30 and other may be at 100. So the refractive types, simple, compound, or mixed astigmatism. So what is meant by simple astigmatism? So in simple, see this diagram. In the simple myopic astigmatism, see the one meridian is focused on the retina, whereas the other meridian is in front of the retina. So patient will require only minus cylinder to get emmetropic vision. So that is simple myopic astigmatism. So in simple hyperopic astigmatism, one meridia is focused on the retina and the other meridia is behind the retina. So we can correct this very easily by just giving a convex cylindrical lens. So that is simple hyperopic astigmatism. So what happens in mixed astigmatism? One meridian is in front of retina and other meridian is behind the retina. So the person will require plus as well as minus cylinder. So both person will require plus as well as minus cylinder. So usually we don't give plus and minus cylinder together. So what we do is we give plus spare and minus cylinder, or minus spare and plus cylinder. Only thing is that the power of cylinder here will be more than the power of spare. So that is mixed astigmatism. In compound myopic astigmatism, it's very simple to easy to understand. Both meridia are in front of the retina, so patient will require a minus sphere and a minus cylinder. Similarly, in compound hyperopic astigmatism, a person will require plus cylinder and plus sphere. So, what are the signs and symptoms of astigmatism? Friends, patients with astigmatism can see if they only have minimal or less cylindrical power and no spherical power, they can strain their eyes and can see the distant objects clearly. So they may complain of eye strain, fatigue, and headaches. And if the vision is not clear, of course, they will complain of blurring of vision. The blurring may be of vertical, horizontal, or diagonal lines, and they might squint to see the objects clearly. So the astigmatic patients tend to squeeze the eyes, producing a narrow stenopic slit effect. So what are the symptoms? The symptoms are, of course, the blurring of vision. But in case of low degrees of astigmatism, the instead of blurring of vision, the patients will have these more of these strain symptoms like eye strain, fatigue, and headaches, because they are squinting or they are accommodating and they are straining to see the uh, things clearly. So how do we check whether the patient has got astigmatism or not? So as with any other refractive error, there are two types of ways by which we can do refraction. Refraction means testing of glasses. One is objective way and other is subjective way. So objective means the examiner determines the power of refractive error, whereas subjective means we put the lenses on the patient's eye and we check whether the patient is seeing clearly or not. So first we do objective refraction, we arrive at a reading, and then we put that reading on the patient's eyes on the trial frame, and we just refine it so that the patient sees clearly, he doesn't have strain. So that is the process of refraction. So how do we objectively determine the refractive error? We can do retinoscopy, we can do keratometry to determine the corneal curvature. Then subjectively, we can do this test like astigmatic pan test and Jackson cross cylinder test after we have proceeded with the refraction. So what do we do basically is we give spherical or cylindrical, either we give cylindrical lenses or a combination of spherical and cylindrical lenses. That is the treatment of choice. Then we can also give contact lenses, and these lenses are called as toric lenses. Surgically, we can do LASIK and PRK, or that is photorefractive keratectomy, as like myopia. So this was all about regular astigmatism, which is very common thing, and which is we can say like a physiological thing. Means there is no other abnormality that is found in the eye. It is just because of slight misbalance between the curvature of the horizontal and vertical meridian. Whereas irregular astigmatism is because of some pathology, friends, and it can be defined as the refractive condition in which parallel rays of light coming from infinity are focused on more than 2 points. This is because the refraction is irregular. As the name suggests, that refraction is irregular in various meridia, and this is because of, say, patient has got chemical burns or patient has suffers a corneal ulcer or corneal injury, then the corneal surface becomes irregular, so it refracts irregularly. So that is called as corneal irregular astigmatism. Similarly, if a person is having retinal swelling or retinal cyst, then the retina also, there may be the refraction may vary irregularly, producing retinal irregular astigmatism. Sometimes lens also contributes to the lenticular irregular astigmatism. So how do we differentiate between regular and irregular astigmatism? Regular astigmatism is a condition in which there are two principal meridia which are separated by 90 degrees, whereas irregular astigmatism is the condition in which there are more than two principal meridia which may not be separated by 90 degrees. And regular is most common, as I already told you, whereas irregular is less common. So regular astigmatism is very easy to treat by using cylindrical or spherocylindrical lens, whereas irregular astigmatism sometimes glasses may not work, so we may have to use special contact lenses, which are rigid contact lenses for irregular astigmatism. So the In irregular astigmatism, the defect of vision will be more than pronounced than regular astigmatism. There may be distortion of the object, there may be polyopia, the person may see multiple images, and there may be aberrations. So, special type of contact lenses such as rigid gas permeable contact lenses or mini scleral contact lenses or rose K contact lenses can be used. And sometimes we have to change the cornea because the cornea is so scarred. So it doesn't give useful vision. So we have to change the cornea. And this process is called as penetrating keratoplasty. So that is all, friends, about astigmatism. So now I have discussed myopia, hypermetropia, presbyopia, and astigmatism. My sincere request to you is you please go through all these topics. If you have any doubts, don't hesitate to contact me anytime. Thank you so much.